Director of the Vaccines and Infectious Diseases Analytical Research Unit at the Wits University, Professor Shabir Madhi, joins me now to discuss this further. Prof, thanks so much for your time. We appreciate it. So it's being described as a new hub to manufacture vaccines. Explain to us, what is messenger RNA vaccine technology?
So good evening. So what messenger RNA technology is it takes a specific part of the genome of the virus, and then it sort of formulates it in such a manner that it can be injected into the muscle, and the muscle's machinery sort of reads that message that's been provided to it to produce the protein that that particular genetic material is coding for. And then that protein is expressed and released into the system and recognized by the immune system as being foreign, and that is what induces an immune response. So messenger RNA technology has been used in the field of cancer research and cancer treatment for a number of years, but it's relatively new when it comes to the development of vaccines. Obviously, the COVID-19 vaccine is the first vaccine, the first disease, or rather COVID-19 is the first disease that has been targeted using messenger RNA technology as a vaccine.
So how would it work? Because we know there's an issue around the patents. Lots of companies are refusing to let go of that, the rights, the patent rights in particular. Is this a way of working around it, or do we still need that to happen?
Yeah, so I think there's a couple of aspects we just need to be clear about. Is that the setting up of this hub will take some time. And even if the hub is fully established, it will take at least 2 to 3 years from the time the hub is established to the time when South Africa would basically be able to produce messenger RNA vaccine from scratch. So we just need to be somewhat realistic of our expectations of this initiative, an extremely important initiative moving forward, but certainly not one that is going to address our immediate need for accessing COVID-19 vaccines before the pandemic passes over. Now, so there's obviously the issue of intellectual property rights, as you correctly point out, where some companies are reluctant to engage in technology transfer. But fortunately, what's happening in the field right now is that there's a number of other biotechnology companies that are developing messenger RNA vaccines that are very keen to partner with low and middle-income country institutions to be able to do the tech transfer. So I don't think it will happen necessarily with the Pfizer vaccine or the Moderna vaccine as an example, but there's a number of other COVID-19 vaccines that are being developed using the messenger RNA vaccine platform. And those companies are very eager to actually partner with middle-income countries that have the ability to manufacture these vaccines eventually.
Yeah, so we know that, Pfizer, Moderna, BioNTech have used this messenger RNA method. Is it a safe way, though? Is that what we've established so far, given what we've seen in the past couple of months?
Yeah, so I think close on to 1 million doses of the Pfizer vaccine has probably already been administered, and the safety profile of those vaccines is extremely favorable. All of these RNA vaccines do induce some sort of reactogenicity, meaning side effects immediately after being vaccinated, such as in a fever or pain at the site of injection, but those are things that we expect of vaccines. But looking at the other more severe side effects, extremely rare. With the Pfizer vaccine, BioNTech vaccine, as well as with the Moderna vaccine. So what's also important to recognize of these RNA vaccines is that this RNA is not integrated into the human cell, into the DNA. So it's not that this RNA material continues persisting for a long time. In fact, after that message is read by the cell machinery of the host, that RNA is degraded very rapidly. So I don't think there's any concerns around safety from the perspective of it bringing about some sort of genetic changes that might have long-term consequences. And in addition to which, like I said, 1 million people probably have already been vaccinated with these messenger RNA vaccines, and we haven't seen anything significant in relation to major side effects.
Of course, it is a long-term historic move, because you say it'll take 2 to 3 years before we actually see this hub producing the vaccines. But we need vaccines now, given the rate in which we're seeing infections in this country. Prof, if I can ask you, Is our government, do you think, doing enough to get other vaccines outside of Pfizer and Johnson & Johnson into the country? They've been in talks, we know, with other countries to get different vaccines in, but we're not hearing any new information about when they're going to arrive.
Yes, I'm obviously not necessarily privy to the discussions that government is having with other companies. Based on the media reports, it seems, and based on what the Minister of Health had indicated previously, it seems that they're very keen for a Sputnik 5 vaccine and a Sinovac vaccine, and I think those discussions might very well be underway. But again, it's unclear as to why they would select those vaccines rather than selecting a vaccine or chasing after a vaccine that has been shown, that has been established to work against the beta variant that's circulating in the country, such as the Novavax vaccine. So not very transparent as to exactly what government is engaging. There might be reasons behind that, but it's really unfortunate that the public is not more aware as to exactly what to expect with regard to other vaccines that could become available to South Africa. Because as we know, even with the Pfizer vaccine and the Johnson & Johnson vaccine, the full delivery of those doses are only likely to transpire after we've experienced a fourth wave, let alone being able to save lives during the course of the current resurgence we're experiencing.
Yeah, that is very worrying to hear. Thank you so much for your time and your insight. Appreciate it. Professor Shabir Madhi from Wits University.